We're back with Dr. David Gutterman from Cone Health. He's talking about all things self-care and mental health for today's To Your Well-Being. All right, let's talk about, as a parent or caregiver, what self-care prevention strategies can you do maybe with your kids that will help teach them some really good habits?
Well, first and foremost, keep in mind that we're always modeling for our kids, right? So they're watching us interact with our relatives and families. So you want to make sure that, certainly in front of the children, that you model good behavior and strategies for taking care of yourself, because again, they will witness and they will see that. I think it's important during the holiday time too to be inclusive with your kids. I think that's a good mental health strategy, to make sure that everyone's engaged and involved with families. So, for example, you don't want the television. No offense, you don't want the television to be the babysitter for the kids, or the video games and the computer. Be inclusive. Include them in conversation. Have conversations that they can be involved with. That's age appropriate at whatever ages they happen to be, and create activities that they can be involved with. That will also help them feel a part of things and much less likely to act out.
Okay. All right. So, but if you think someone is struggling, a friend, a loved one, a family member, what should you do? Should you try talking with them about it? And if so, how do you approach that conversation? And how do you know when to stop? Because I think that's difficult too.
Right. I think it is very important that if you have a friend or a family member who it's obvious to you is struggling, to inquire, to ask, and you ask permission. That you let them know how you're experiencing them and why it is it's your impression that they might be struggling, and ask them if you care very much about them, and that you'd like to open the opportunity for them to share with you what's going on. It's always worth risking. It sometimes feels intrusive, but it's worth risking, letting someone know out of your love and out of your care for them that you're concerned, and to open the door for them. If it goes too far, if someone feels like you're being intrusive, they generally will let you know, and it will not be that subtle. They'll let you know that they're uncomfortable with it, and most importantly, it's vital that people understand that there is help out there, and there are lots of resources right here in our community to be helpful to people.
And I guess that's kind of like my follow-up question. At what point do you think someone should consider it is time maybe that you reach out to a professional person for help?
Right. I think that when it's persistent, when the symptoms, whatever those symptoms happen to be. So if it's someone looks especially depressed or especially anxious, something like that, and if it's persistent, not just in the moment or that day or that evening, and it's really starting to interfere with their interactions, it's starting to interfere with their quality of life day to day, that's when you reach out. You don't, like with most things medical, you don't want to wait until the symptoms are extreme. You're starting to struggle, starting to have a difficult time, you reach out, you speak to a professional. If it's something that's really minor and can be addressed quickly, that's great. Or if you don't need help at the time, that's terrific. But again, better to err in the direction of seeking some assistance.
All right, we got about a minute left or so. What resources are available? I mean, because there's a lot of folks who I wouldn't even know what to do. I wouldn't know who to call. I wouldn't know where to turn.
Well, in an emergency type of a situation, if it's someone who you feel is in danger to themselves or something of that severity, of course, is the 988 hotline that one can call. Guilford County Behavioral Health Urgent Care has 24/7 coverage. So at any time, day or night, you can go to the facility or call a facility and reach out for help. Again, especially evenings, weekends, for more emergent situations. Cone Health and LeBauer Healthcare, we have psychological services available in person as well as virtually. So that's an important thing to remember as well. So access is much easier than it's ever been before, so that you can reach out, meet someone online, a professional online, and have a conversation, share your situation, and then make a game plan from there. So there are several avenues people.
All right. Well, thank you so much for your time and your expertise today, and for reminding us that we do need to make sure we have good self-care, especially during this time of year. You can find a full recap from today's Q&A on WFMY News 2 in just a few moments. You're going to click in the To Your Well-Being section.